topic in this lecture is chronic ulcer. Dear students, we'll discuss a case study. See that very common entity. So what is this condition? Look at that. It's a hand actually. So much necrotic area is there. Slough is there. You can see the edge. You can see the surrounding area. Edematous, pigmentation. All features of infection is there. So many things. Suppuration is there. Pus is there. So what is this condition? It is a chronic ulcer. Non-healing ulcer. All of you know that clinical classification is healing ulcer, non-healing ulcer, callus ulcer, spreading ulcer. Spreading, non-healing, healing, callus. So this is a non-healing ulcer. And features are ulcer edge is sloping, slough over the floor with purulent discharge. Surrounding skin is pigmented, indurated, with some palpation of course, less tender, regional lymph nodes will be enlarged. So ulcer, all of you know the parts of the ulcer. This is the base, this is the floor which you can see, this is the edge, this is the margin, base is felt, not seen, floor is seen and felt, edge is seen and felt, margin is seen. This is the surrounding area. These are the parts of the ulcer: base, floor, edge, margin, surrounding area. This all of you know. All of you know clinically. Regional lymph node may get enlarged. You should always examine. Up here it is axillary lymph node. So what is the management? Here you can see the over the wrist it is, joint we don't know. So we have to assess the joint. You have to send the pus for culture, and you have to check the circulation. You may have to do arterial Doppler, venous Doppler, both. And discharge, you have to do cytology, culture, AFB if it is tuberculosis, and wedge biopsy if you are thinking something else. Sometimes tissue biopsy also you have to do in uncommon bacteria, the atypical mycobacteria. Tissue culture is important rather than discharge culture. So all those things you have to decide depending on the situation, your trial and treatment. And X-ray should be done always because osteomyelitis of the wrist bones and metacarpals may be possible. That was a very problem while managing such a patient. Lymph nodes are FNSA of the lymph node because it must be a reactive or inflammatory. Hematology, blood test, blood count, C-reactive protein, and diabetes assessment, kidney function assessment should be done. And correction of anemia, diabetes if it is so, improve nutrition is very important here. Healing of the ulcer based on the nutrition and hemoglobin and albumin level. Blood transfusion if required, antibiotics should be given according to based on the culture sensitivity. Rest, immobilization, avoidance of repeated trauma. Repeated trauma will aggravate the problem, so you should avoid that. So it's the management policy and care of the ulcer. If wound debridement may be under brachial block or under general anesthesia. Local may not be sufficient here. Daily cleaning and dressing, different method, de-slouging, topical antibiotic, and vacuum assisted closure. Negative pressure wound therapy, otherwise called as negative pressure wound therapy, is a short note for you. Vacuum assisted closure is a short note, very commonly used now, very popular because of the negative pressure. It promotes the granulation tissue formation, removes all infected discharge fluid so that keep the wound healthy and clean, and promote the healing, control the bacterial load. Everything is very useful. Currently it is said that once it granulates well, then you have to put a split skin grafting, CST grafting. Donor area site is usually from the thigh. You have to use the Humbee's knife and Eschmann blade, and currently of course electrical dermatose also available. And eventually to get the function of the hand is very important. To get the function of the hand back, proper physiotherapy and rehabilitation is very important. Physiotherapy is the most important thing. Once wound cover you put with the graft and wound heals. So physiotherapy and rehabilitation is very important in this patient after managing this ulcer wound as such. So causes of non-healing of the ulcer, I am not going to detail it. The common short note asked, MCQ they will ask, IUA they will ask. When kept for a short case also to be asked. Recurrent infection, trauma, foreign body, absence of rest, poor blood supply, edema, loss of sensation, osteomyelitis, and general causes classified as local cause and general cause. General cause, all of you know, anemia, albumin level, tuberculosis, diabetes, immunosuppression, malnutrition, and chronic liver and kidney diseases, malignancy, radiotherapy. Patient who is on steroid, mainly so many conditions they take steroid, asthma, arthritis, immunosuppressive diseases, immunological diseases, they use immunosuppression using steroid. So in such a situation, infection is very common. So ulcer may not heal if at all. ulcer is there, it becomes chronic. So these are the different causes which you have to always remember. Common question asked, why you are everywhere. MCQ also they will ask. So answer the MCQ. What is the common site for venous ulcer? A, over the heel, over the dorsum of the foot. B, C, around the ankle. D, over the great toe. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in the table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination, remember. And many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn. Very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. It covers theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations, and you should else worldwide also, actually including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB's operative surgery atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything, with total around more than 10,000 illustrations and photos. It gives very good principles and technical, step by technical aspect. Very useful for postgraduates. Not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book and memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step by step with illustrations. And my SRB's atlas of tissue approach, small book atlas, 100 pages, how to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with the videos. You can always go through that. And my website, please subscribe, all of you. Your daily lectures are there, live sessions are there. My digital lecture through JP Publishers, around 220 hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well, and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.